Hello everyone, my name is Hagir and today I'll be presenting the ultrasound assessment of the female pelvis. We'll cover the indications for ultrasound, the two main approaches we can take, go over some of the preparation required, and finally outline some important safety tips. So pelvic ultrasound in general is quite versatile and has many different uses in obstetrics and gynecology. On the screen you can see some of the main reasons we use it. So for example, assessing pelvic pain, whether that be acute or chronic, visualizing pelvic masses, and monitoring both the mother and fetus during pregnancy. So now that we have identified some of the indications, our next step is to select the correct probe for assessment. So first we have transabdominal ultrasound using the curvilinear probe. This gives us a broad overview of the uterus, adnexa, and large pelvic masses. It is useful for patients who cannot tolerate transvaginally or for very large pathologies which would be adequately projected. We can also do an ultrasound transvaginally using the endocavitary probe. This produces images of higher resolution of the uterus and endometrium and is useful in the early detection of adnexal pathology. It is the preferred first line for acute gynecologic emergencies, so that being ovarian torsion, tubo-ovarian abscesses, and ruptured cysts. So before the patient comes into their appointment, it is important to advise them on how to best prepare themselves. So for transabdominal ultrasounds, they must have a full bladder, as this helps displace the bowel gas which could interfere with the images produced. The patient is positioned supine and their abdomen is exposed. For the transvaginal ultrasound, the patient must have an empty bladder for their comfort and must be positioned in the lithotomy position as shown here on the screen to allow close proximity to the pelvic organs and allow for optimal imaging. And of course, hygiene is very important, so sterile gel is applied to a disposable covering before assessing each patient using this probe. So before I go over the safety tips, it's important to understand how exactly ultrasounds work. So these are high-frequency sound waves which are emitted from the transducer and are reflected back by the body's tissue. The probe receives these waves and a 2D image is generated. Tissues that reflect more of these sound waves are described as being echogenic and appear brighter on the image. So for example, if we image bone, that would appear more white or bright on image compared to, for example, fluids. Another important thing when it comes to safety is knowing about the mechanical and thermal index. So the mechanical index is a measure of how much energy is transferred to the patient during ultrasound. As we know, sound waves are used to produce the images we see, and these have the potential to damage the tissue that they pass through. For this reason, there is a limit on the mechanical index that a patient can be exposed to, depending on the indication. We also have the thermal index, which is another safety metric, which indicates the potential of creating heat within an ultrasound beam. This thermal index varies with different types of tissue. So for example, TIS, which is soft tissue, is used or is displayed early in the first trimester to assess fetal heart Doppler. We also have something called the ALARA principle, which stands for as low as reasonably possible. This refers to using the lowest possible ultrasound power and shortest scanning time needed to obtain adequate diagnostic information. So it is best to start with a lower output setting and increase if needed, rather than unnecessarily exposing both the mother and fetus to potential for harm. So for example, if a mother wants to hear her baby's heartbeat, Doppler should only ideally be used for 5 to 10 seconds. This paper by the International Society of Ultrasound in Obstetrics and Gynecology advocates for using the ALARA principle. So as we can see here, they state that from 11 to 13 plus 6 weeks, the displayed thermal index should be less than 1 and exposure time should be kept as short as possible. And finally, one of the most important ways we reduce the risks, costs, and time wasted is to correlate the clinical history to the study ordered. To summarize, these are the key measures we should take to ensure safety of patients undergoing ultrasound assessment. Firstly, we should apply the ALARA principle, not only for pregnant women, but also children, teenagers, and young adults. The aim here in this population is to minimize the exposure to the ovaries as much as possible. Secondly, 3D and 4D imaging should not be performed without a valid medical indication. This means refusing to take images simply for keepsake purposes. M mode is preferred over Doppler for parental reassurance as it confirms fetal cardiac activity while minimizing energy exposure, which also aligns with our ALARA safety principles. On the same note, Doppler use should be strictly limited, especially in the first trimester. We should always monitor both the mechanical index and thermal index. The aim is to keep TI below 0.7 or below 1 with a time limit of 5 to 10 minutes, especially in the first trimester. Finally, simulation sessions are ideal for beginners so that only trained operators can scan patients, which reduces unnecessary exposure and ensures accuracy. These are my references, and thank you so much for listening. I hope this video was beneficial.